CS TMC Exam Two. Question 1. Which of the following are potential complications that might occur as a result of an underinflated endotracheal tubes cuff? 1. Tracheomalacia yes, tracheostenosis yes, gastric insufflation yes, aspiration no. 2. Tracheomalacia no, tracheostenosis no, gastric insufflation yes, aspiration yes. 3. Tracheomalacia no, tracheostenosis no, gastric insufflation no, aspiration yes. 4. Tracheomalacia yes, tracheostenosis yes, gastric insufflation no, aspiration yes. 2. Tracheomalacia no, tracheostenosis no, gastric insufflation yes, aspiration yes. Question 2. Which of the following can be determined from simple spirometry? 1. FVC yes, FEF 25%-75% no, FEV1 yes, FRC yes. 2. FVC no, FEF 25%-75% no, FEV1 yes, FRC yes. 3. FVC yes, FEF 25%-75% yes, FEV1 no, FRC no. 4. FVC yes, FEF 25%-75% yes, FEV1 yes, FRC no. Number 4. Question 3. An adult point being weaned from mechanical ventilation has a maximum inspiratory pressure, MIP, of -34 cmH2O. On the basis of this information, which of these is true? The point has adequate inspiratory muscle strength. The point requires reintubation. The point has severe restrictive lung disease. The point is not ready to be weaned. The point has adequate inspiratory muscle strength. Question 4. Monitoring of airway pressures and flow rates during continuous ventilatory support is useful because they best reflect changes in oxygenation, airway resistance, cardiac output, pulmonary artery pressure, airway resistance. Question 5. ART increases the VT of a mechanically ventilated point from 475 ml to 525 ml. This would result in a decrease of which of the following? POW2. VD/VT, alveolar ventilation. Peak inspiratory pressure. VD/VT. Question 6. Determining the effectiveness of therapy for an adult male with septic shock would be best accomplished by which of the following? Pulse oximetry, pulmonary artery pressure monitoring, peak flow measurement, capnography. Pulmonary artery pressure monitoring. Question 7. Which of the following must be known in order to calculate the CHOW2? 1. POW2 no, POCO2 yes, HB no, SAW2 yes, pH yes. 2. POW2 yes, POCO2 no, HB yes, SAW2 yes, pH no. 3. POW2 yes, POCO2 yes, HB no, SAW2 no, pH no. 4. POW2 no, POCO2 no, HB yes, SAW2 no, pH yes. Number 2. Question 8. Which of the following must be measured in order to determine a PTSIE ratio? 1. RR yes, anatomic dead space yes, inspiratory flow rate yes, VT no. 2. RR yes, anatomic dead space no, inspiratory flow rate no, VT yes. 3. RR no, anatomic dead space yes, inspiratory flow rate yes, VT no. 4. RR yes, anatomic dead space no, inspiratory flow rate yes, VT yes. Number 4. Question 9. Which of the following is the normal range for capnography? 10 to 20 mm Hg, 35 to 45 mm Hg, 50 to 60 mm Hg, 80 to 100 mm Hg. 35 to 45 mm Hg. Question 10. Electrocardiograph monitoring provides specific information about the heart's mechanical contraction, electrical impulse activity, stroke volume, ejection fraction. Electrical impulse activity. Question 11. A point has just been admitted to the ED following a gunshot wound to the head. During assessment, The RT observes that the PTS pupils remain fixed and dilated when a light is shined on them. This indicates that the patient is under the influence of opiates. The brain is probably hypoxic. The optic nerve is intact. The patient has a normal response. The brain is probably hypoxic. Question 12. While assessing a point to determine if respiratory treatments are indicated, the point tells the RT that he becomes sob when lying down, but when he sits his breathing is fine. Which of the following terms should the therapist record in the PTS chart that would best describe the PTS statement? Eupnea, tachypnea, orthopnea, apnea. Orthopnea. Question 13. A 3-year-old child has been admitted to the ED for increasing respiratory distress. The mother states that over the last 24 hours, the child has become increasingly sob with choking and coughing episodes. Physical exam reveals an anxious point in moderate respiratory distress with a RR of 36/min and a pulse of 132/min. Chest auscultation reveals intermittent expiratory wheezes, more on the right than the left. On the basis of the PTS clinical symptoms and chest X-ray, the therapist would suspect which of the following: asthma, croup, foreign body aspiration, epiglottitis. Foreign body aspiration. Question 14. Which of the following best explains the results of the chest X-ray shown? There is fluid in the right pleural cavity. There is a pneumothorax. There is consolidation in the left lung. The heart is enlarged. There is fluid in the right pleural cavity.